Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight we're going to get to general questions. But first, we're going to do what, Dad? Part 2 of blood pressure. And then you tell me there's lots going on in the news. So we'll be going over all that too. Great to see you both.
I really need, there was just so much happening this week that I wanted to
You need
share
2
with
hours.
you some of the findings. Take 2 hours. Some of the findings that are not new, that just keep repeating themselves and emphasizing the points that I made to you, 47 years ago. And, you may think that I'm just looking out for things that support my point of view. That's up to you. But you could also review the science along with what I suggest to you and see who has the majority point of view. I have the majority point of view. I'm not exaggerating. I'm showing you some things that I've learned over the years, which are being published in this week's journals and newspapers. Oh, it's just crazy what's going on. Let's see if we get this. All right, Heather, do you have a picture there?
I do. Yep, looks great.
All right, see, I got a new beginning. But let us know which
I see that fancy.
Everybody who wants to do, your friends, your relatives, everybody you know who's tired of being fat and sick can join us every Sunday night, 5 o'clock Pacific time on our YouTube channel, the McDougall channel. I'll tell you, if you got a friend that you'd like to do some good for, introduce them to John and Mary McDougall. We're pretty decent people. Don't forget Heather either. So, we're here to help and we get so much enjoyment out of it. Well, let's proceed. Okay, big headlines all week. The avian, the bird flu virus getting into the cattle, getting into the milk supply. They report so far 2 people sickened, maybe more, but so far I've read about 2 people sickened with avian flu by drinking dairy products, cow's milk. And the thing that's really concerning is this has reached a political point of view in the sense that you see this article from the New York Times, May 24, 2004. This is politics, to its most harmful extent, where they say raw milk's risks do not stop right-wing commentators from, they just think
defiantly pushing it.
They think all the facts are alternative facts, don't they? Anyway, we won't get into politics, but that's been a big part of the headlines.
So they're telling people to go ahead and drink raw milk.
Okay, it's just a conspiracy theory.
Oh.
It's just the government trying to make you confused. Keep you from this wonderful health miracle, raw milk. Excuse me. You notice down here, I give you a list of where to see my lecture that I gave in June 13th, 2013. Ladies and gentlemen, what is that? 2013? That's like 20 years ago.
You talk about raw milk in that marketing milk.
Well, I talk about leukemia viruses.
Oh, okay.
And this is similar. And I did mention raw milk as well.
So raw milk would.
But you've got bovine leukemia virus. You got tons of viruses, and I do mean tons. Gee. So if you're going to eat any animal foods, you're going to run into that risk because they're all infected with microbes, viruses, et cetera. We need to move on. Okay. One of the things that you object to when I talk to you about the kind of treatment I have, one of the things that you bring up in question is your doctor has recommended drugs like Fosamax and other osteoporosis drugs to you.
Oh no.
What happened?
Well, Heather,
We
I
don't
have
know.
no idea.
It looks fine on my end.
Does it? Okay.
Yeah.
Well,
No, there it is.
anyway, how does that look? Still see it? You see
Fine,
that
yeah.
Fosamax increasing pressure?
I do.
Well, that's just wonderful. All right. Well, Heather, and I've tried to tell people these drugs are dangerous and they have extremely little benefit. They talk about relative benefits rather than absolute benefits. So, if your risk of having a fracture is like 2 in 100 without having Fosamax, and it's 1 in 100 with having Fosamax, they tell you it's a 50% reduction in your risk of fractures. So they lie, they do this, a lot of lying in terms of relative versus absolute, whereas the absolute benefit is only 1 in 100. Now that's a little bit complicated for this discussion. Anyway, this is out of JAMA this week. Fosamax fractures. Justice has not yet been served. It's about the thousands of people who suffered from these fractures. You see these subtrochanteric femur fractures. This is your big bone in your leg. And it just breaks for no reason. You just stand around, the darn thing breaks. And it's because
Well, it looks like it's right by the hip too, right?
Yeah, it's right up. It's the kind of the hip bone, right?
Yeah.
And this is your big leg bone, your femur.
Okay.
It just busts, for no apparent reason.
Why are you just standing there?
And plus, Merck, the manufacturer, was aware of the problems of this drug years before they warned the consumer. And they said it's because they worried about doctors not being able to prescribe the drug as frequently if they put in this side effect. Oh, yeah. Well, you're dealing with businesses, ladies and gentlemen. They act like businesses. They're interested in profit. The consumer often comes second. All right. Well, these drugs, what do? Is they reduce bone turnover. Well, part of that bone tumor is remineralization. It's regrowth. And they stop that. They stop the osteoclastic activity where it breaks down the bones. Anyway, that was in this week's JAMA. All right, let's see.
And you've been talking about that for years.
Oh man, I'll tell you. Okay, here's a question I've come up with lots of my patients. Remember, I've been doing this for 55 years, at least. Good grief. Anyway, a question will come to me from somebody who's terminally ill, particularly cancer patients. And they'll say to me, should I join this clinical trial? Clinical trials all over the world, hundreds of them, if not thousands of them. And what they're for is to try some new chemotherapy or new radiation protocol or something new that's experimental. And they ask you to join as a participant in this experiment. Now, I've always told people when they ask me if they should do it or not, the answer is no. They should not be experimenting on you. And it's nice to see this article, Survival Benefit Associated with Participation in Clinical Trials of Anti-Cancer Drugs. And what they say is a systemic review and meta-analysis of 39 studies comparing outcomes on cancer patients who are receiving cancer. The pooled results of high-quality studies are not consistent with a beneficial effect of trial participation on its own. Don't do it. Let somebody else test it. Not my patients. Not my patients. Maybe somebody else's patients. But anyway, that made me feel good. At least there's the literature, the research that's done. This is the first study I know of that really addresses that. What do you tell your patients? The thing is, you just hope there's going to be some miracle cure. You want to be a noble person and participate, but you're going to be not helped.
Yeah, you read the conclusions.
Yeah. Not helped, and you're probably going to get hurt. You're going to get a lot of attention, though, and maybe some of your medical bills paid. Don't do it. All right. This week's, let's see, what's this? This was the New York Times, I think, also. It's a study that came out this week talking about the diet of a group of people that are from the area of the world, Morocco. You know where that is. I'll throw you a picture there. And what they did is they found their teeth. And there were 7 individuals, they found their teeth, and they lived in this cave 15,000 years ago. Now, this whole bit about hunter-gatherers, right? I tried to tell you this is a gender bias thing. This is sexual discrimination. This is men putting women in their place. And that is, there's the idea that we're hunter-gatherers with the emphasis on hunting. Not true. Hunters didn't do so well. They rarely brought back anything worth eating if it didn't spoil. It was the grandparents, the women, the children that gathered the food in such societies, always up until maybe 150 years ago or 100 years ago. Anyway, obviously, the agricultural revolution took place more than 10 or 12,000 years ago. Here's a population of people, they ate sweet corn, pine nuts, pistachios, oats, legumes. Yeah. Anyway, you can tell what somebody has eaten long-term by looking at the mineral content of their bones, hair, and teeth. And what these people are is they're near vegan. They had maybe once in a while, they got a Barbary sheep, and they weren't vegan. I mean, they were opportunists. But, 90 plus 99% of their diet. And the statement I've made to you just goes to prove, and I've shown this, I bet I have 100 different societies. I don't have any to the opposite. 100 different societies that go by this statement that I made to you so many times. And that's all large, successful populations of people throughout all of verifiable human history have obtained the bulk of their diet from starches. You know, Asians, rice, Aztecs, Mayans, people of corn, etc. You can't find me an exception except people who live at the extremes of the environment, or a few, unusual tribes living in parts of the world. The people living on the extremes of the environment, of course, the Inuit Eskimos. But otherwise, take 99.99% of the people. Why would we eat differently? Doesn't make sense, does it? Okay, now I've addressed this. This is going to be the part of the presentation that you didn't pay to see. But I got to tell you, first thing you need to understand, and you'll understand it by reading this particular New York Times article, is you'll understand that we're way past the CO2 problem. Yes, we need to change our diets to cut CO2 production by a lot, maybe 50 to 80%, going to a McDougall type vegan diet. Yes, we need to do that. Yes, we need to get under control of our transportation, our energy needs. We got to do that. But you know what? We have, as depicted here in the chart, in the graph here, we have, 1,000 times. It takes us 1,000 years to get rid of the CO2 we built already. And I want to point out to you, I look outside of the freeway and I don't see anybody cutting down on gas burning cars or anything. So we've got to abandon that idea. And so they have in the newspapers, and I don't know if you're paying attention, but I want you to pay attention. They talk about the best way to find out if we can cool the planet. And they talk about geoengineering. And I brought you some discussions about this, like from the Washington Post. And the concern is that a lot of the geoengineering projects would result in a disaster, like spraying particles up in the atmosphere. It's, that's something to worry about because you can't take them out of the atmosphere if you overdid it. All right. So anyway, this month, in fact, a couple of days ago, in the New York Times, they've talked about taking the mist of water and shooting it out in the clouds, and again, reflecting the sunlight. They think that's a pretty safe way to do it. But at least they know it has to be done by geoengineering. We've got to cool the planet, irrespective of the CO2 problem. And that's where I want you to pay attention. And there's your homework. I want you to look up this website, because I think this is the only practical way we could do this. This is a project called Mir. Yi Tao runs it. He's really a smart man, to say the least. And they're doing some work in Freetown, Africa. And you can see on the right-hand corner where they put mirrors on the top of buildings. The mirrors cost $10 a piece to make. You can make them out of plastic bottles and aluminum cans. If you reflect too much sunlight and the planet gets too cool, you can turn them over. It's all volunteer. Nobody's figured out how to make a profit off this. But ladies and gentlemen, you better figure out how to get the word to your friends and relatives, because I know we're a small group, but maybe somebody will find us. Who knows? All right, let's get to the talk you came for, and that's high blood pressure. Let's talk about high blood pressure. First of all, yeah. Okay, so hypertension is really not the problem. The problem is that people are eating all these animal foods, which have a ton of salt in them. Otherwise, you can't eat them because they taste bland or disgusting. So you cover up in salt so they become palatable. As I said before, it's the pig, not the bacon. It's not the salt. It's the animal foods that are getting you in trouble. All right, high blood pressure. This time I told you high blood pressure goes up because you get excited. Your pressure goes up because you eat salt. Salt will do it, increase volume. And I talked to you about peripheral resistance last time. How you put your hand over the end of the hose, you increase peripheral resistance and the pressure goes up. It needs to compensate. All right, and I explained to you that healthy blood vessels don't break. Remember that? We talked about that last week. Here's a weightlifter, or a group of weightlifters, 320 over 250 millimeters of mercury, and not a single healthy vessel breaks. And I showed you blood vessels out of 10 cadavers, 10 human cadavers, and they blew the pressure up to 3,000 millimeters of mercury before the blood vessels started breaking, an average of 1,786 millimeters of mercury. Healthy vessels don't break. The problem is you have rotten vessels, and this is where we start with the new presentation. You have rotten vessels. You see the progression time of the disease of the arteries. They start out clean on the left-hand side. They continue to get sicker and sicker and sicker, and they finally get to the point where some of this disease ruptures and produces blood clots. And that's how you get a heart attack or stroke. It's not from gradual closure of the arteries. It's from sudden rupture of a plaque. All right, recommendations. I told you this time I was going to talk to you about how I treat high blood pressure. And here's the new material. You can review the old material last week's. First of all, you need to have a quiet situation. You can't take the blood pressure from the office. Everybody agrees that office blood pressures are irrelevant. You're scared, you have white coat syndrome. So you get relaxed, you sit down, put the cuff on, take some time. There's also a long-term monitor that you could get to check your blood pressure. All right, normal blood pressure. Normal, they say, is 120 over 80. Some people say 100 over 70. It's down in that range. But actually healthy is lower than that. But high blood pressure, you get up to 180 over 120. That's pretty high blood pressure, isn't it? But anyway, how do we treat high blood pressure? Well, the Cochrane collaboration, which is the most respected review organization on the planet. Okay, they got over, they've got, over 100 countries. They've got over 40,000 scientists, researchers looking at this, various studies. And when they look at the literature, the Cochrane collaboration tells all of us doctors worldwide that there's no benefit from treating somebody to a blood pressure lower than 160 over 100 or maybe 140 over 90. So they put their limit at 140 to 160 over, say, 90 to 100. You should not start treating unless it reaches those levels. And then you have the National Health Service, which is the British healthcare system. They started saying in 2004 and still say today that you should initiate blood pressure treatment if the blood pressure is sustained for months, not hours, months, over 160 over 100 millimeters of mercury. Then you introduce blood pressure medications. And then the American Heart Association, they came out with a similar recommendation. And they tell people that at my age group, you shouldn't treat, that's the center circle there, you shouldn't treat high blood pressure unless the pressure is 150 or higher. You don't forget that or higher part. And the bottom number is 90 or higher. Some of you are being treated for blood pressure of 140 over 80 or 150 over 85. You shouldn't be treated. That's what the research says. Out of this week's Journal of the American Medical Association brought an article pertinent to today's discussion, and that is blood pressure drugs are linked to more fractures and falls. Any kind of blood pressure drug. Why? Because it causes dizziness and loss of balance and so on. So putting people, particularly the elderly, on medication is a serious health hazard. Anyway, this was published just yesterday.
Because when you take drugs, your blood pressure can get too low.
They're going to get too overtreated.
And then when you get your blood pressure is too low, then when you stand up, you fall down.
That would be the most common sign. They say you have twice the risk of fractures if you're on blood pressure medication, an 80% increased risk, and you having a fall, which results in an ER visit, and almost a 70% chance of dizziness. So you got to be careful not to overtreat. All right, the drug I use, and this is for you to look at later, is chlorothalidone. I don't use hydrochlorothiazide. And if you read these two papers, you'll understand why. Chlorothalidone is the drug that was tested back in the 1970s, which showed a reduction in stroke and a reduction in heart failure. The other drugs, all they do is lower blood pressure. They've not shown this clinical relevance of a reduction in disease. Okay, and hydrochlorothiazide, which you are usually prescribed, as opposed to chlorothalidone, doesn't work as well. It's not the right drug. And so these two articles tell you such. Read them if you're on these drugs. I don't prescribe calcium channel blockers. They increase your risk of dying. increase your risk of heart disease. They said about 60% increased risk. And here's some of your calcium channel blockers. You're on these pills. Talk to your doctor about getting off them. And the other category of drugs I will not prescribe are your angiotensin receptor blockers, which again, increase your risk of having a heart attack. This is not an argument, ladies and gentlemen. Well, a little argument. It's a little controversy, but the evidence is so overwhelming anyway, that these drugs, particularly the calcium channel blockers and the angiotensin receptor channel blockers, should not be prescribed. And that's one of the first things that we do at the clinic is take you off these two drugs. And if you need blood pressure medication, and you might, we prescribe blood pressure medication. Yes, we do. We start you off on about a half a pill of chlorothalidone, because they don't make a pill small enough to benefit people who are on our diet, because their blood pressure is so good anyways. Anyway, we will put you on blood pressure medication. Dr. Lim and I both have blood pressure cuffs available, and we have prescription pads, so we're happy to do it. We're not going to leave you incorrectly treated. You can plan on it for our sake as well as yours. Okay, what I mentioned to you in the beginning was that, the problem is not the salt. The problem is the pig. And that's what you ought to focus on. You can't eat cheese unless it's loaded with salt. Most butters are loaded with salt. Your packaged foods are loaded with salt, your refined foods. And this is the classic example. It's not the salt, it's the pig that's making you sick. And that's what you need to focus on. Here's the only study out there that really addresses high blood pressure and diet. It's called the DASH study, done in 1997. It was the Mediterranean diet with a reduction in salt, okay? And they didn't get much benefit at all. They put them on three different regimes of sodium intake, and look at what they got. They got a reduction in people who had high blood pressure of only 11/5 millimeters of mercury, but in the general population, over 5/3 millimeters of mercury. Hardly anything by taking the salt out of it. They cut the salt in half, at least. In other words, what I'm trying to tell you is salt reduction gives you very little benefit in terms of reducing blood pressure. You've got to go the whole route. And by the way, the diet they're using is the McDougall diet with added nuts and fish and olives. That's what the Mediterranean diet is. But they don't add so much on the DASH diet. That's right. There are more vegetables and less animals on the DASH diet, proving the point again. All right. What we do is we recommend that you use salt if you like it. We don't want to start any bad habits. But if you like it, use a little salt on the surface of the food. If you put salt on the surface of the food on the McDougall diet, you hardly consume any salt at all. Our basic diet is 500 milligrams. A half a teaspoon of salt is 1,000 milligrams of sodium. If you add the two together, that's 1,600 milligrams of sodium total on our diet. If you end up at the intensive care unit after a massive heart attack, their low sodium diet is 2,000 milligrams more than ours, which has 400 milligrams less than the ICU low sodium diet prescription. Amazing. All right. So we want taste. We want you to eat the food. We want you to enjoy the diet. And adding salt is the thing you're missing. I assure you, if you don't initially have a favorable response to the food, you're missing the salt. Fix it. All right. So anyway. These are the results on our patients. Average drop in blood pressure is 18/11 millimeters of mercury. And that's for people who started with real high blood pressure. Remember, the Heart Association, the Cochrane Collaboration, and the National Health Service says you don't have high blood pressure worth treating unless you're at least 140/90 millimeters of mercury. Well, just looking at these people who were properly categorized to take blood pressure pills, we got an 18/11 millimeter drop in 7 days on these people. Plus, the thing you need to understand is we were able to reduce or stop the blood pressure medications in nearly 90% of the people. All right, that's probably enough, Heather. I hope I didn't go too long. I just had so many things I want to tell you. No, I did okay.
That's great. We appreciate
I
your,
even got my plug in about the environment, which I know is counterproductive because I know you don't want to hear about it. You know, just like there was a time you didn't want to hear about your diet.
Yeah, but
Remember?
now it's in the paper.
All day
I
long,
mean,
every
and
day.
they talk about spraying the air with I read that thing about spraying the air with seawater too.
Well, you know, I gave my first talk September of 2019 to the American College of Lifestyle Medicine on diet and and global warming. I gave it to over 500 people, probably thousands have listened to it. And one of the things that happened afterwards is that one of the young doctors came up to me who was studying to become a certified doctor in the American College of Lifestyle Medicine, which is an organization Mary and I helped found in 2004. He said, he walked up to me, he says, "Doctor, there's no place for me to practice on a dead planet. Think about it. Whatever you're doing, you can't do it on a dead planet. So we have to work on this. I can't help you be healthier if we have a dead planet. I can make you change to the McDougall diet if we have a dying planet, because that's what's going to happen. You're going to be eating what I recommend, at least temporarily." All right. So Heather, go ahead. I'll let you turn it over to a much more positive point of view.
okay, lots of questions coming in. This first one came from Summer. She wrote me and she has, oh goodness, now I've lost it. She has, oh goodness, I don't know where it went. Anyway, she has terrible digestive issues, low pancreatic enzymes. She can't even digest cooked sweet potatoes. What would you recommend?
Well, there are enzymes you can buy. They're prescription and they're also over the counter. And these are prescribed who people do have a deficiency in excreting amylases, for example, from the pancreas, or other types of enzymes that break down carbohydrates in particular. And so you can buy these, and I'm sure this patient has been offered this opportunity, or should have, if she consulted any medical doctor, to take these additional enzymes. And I used to know the name of a couple, but I can't remember anymore. But that's what I would do. First of all, you know, I always have to ask Heather, do you really understand what we're teaching? Are you really following the diet that we suggest? And often they say, well, you know, I'm getting close, or, you know, 5 days a week I do, or, you know, it's just not quite there. And until they say, look, I follow the McDougall diet based on starches with fruits and vegetables, no animal products, no oils, till they can look me right in the eye and say, that's what I'm going to do, then I don't have any other dietary recommendations for them. But I do, especially when it comes to GI tract problems. The next step is consider yourself to have a problem with gluten, celiac disease, or some minor relationship to celiac disease. Wheat, barley, and rye you avoid, which is really easy. You know, I think it's my September 2019 newsletters about gluten and what the starches are, like rice and corn and wild rice, and, you know, all your potatoes. You got tons of starches to eat. And then the last thing you do, which is in my May 2014 newsletter, is you try the elimination diet. Often problems will be resolved just with simplification of your diet. If not, these enzymes are the way to go. Hopefully they help.
Thank you. Thanks. Okay, next question. Do you know what HIPEC, HIPEC treatment is?
No. Look it up, Mary.
I should have looked it up.
No, I
Sorry.
don't know what that is, Heather, but I bet it's something I've heard about.
So
You know
here's
what
a
it is,
question.
Heather?
I don't. I should have looked it up before I asked. My mistake. Here's a question from Quiet Storm Maps. Can you lower your risk of breast cancer on a starch-based diet if you're taking hormone replacement therapy?
Yes. You know, it's not just the estrogens. Estrogen is something you have to pay attention to. But I don't know of any doctor nowadays that would prescribe estrogen to a woman who has breast cancer. I would never do it. So I think you ought to go back to the basic prescriber and say, what are you doing? I actually had a situation many years ago, 30 years ago or so, where I was taking care of a patient who was taken care of by another doctor in town And that doctor put her on hormone replacement therapy. She had breast cancer. I told her to stop it. I actually got a call from that doctor telling me, that I didn't understand the science. Excuse me. That was 30 years ago. No doctor would say that today. So you should be off the estrogens. You ought to do other things to help you with your bones. I assume that's your bones. And they would be things like taking a walk, getting sunshine, and eating the kind of low acid, low protein diet I recommend. If you're taking it because of hot flashes, I think if you just generally get healthier, that will solve a lot of the problems. Plus, in chapter 13 of the book, do you have the women's book up for free again, Heather?
I don't. It's the Healthy Heart right now.
Oh, okay. Well, we'll put the women's book up for free again. But in there's a whole section, chapter 13, the last part of it. I talk about herbal things like black cohosh, and there are a bunch of other things that people take for menopausal symptoms. And I've never been impressed with them, but why not try them? They're cheap, almost no side effects. Give it a try. But I think if you just improve your general health, you'll be okay when it comes to menopausal issues. Plus, menopause generally lasts only 2 years. If it's lasting longer than 2 years, I think I would think about something else that's preventing you from having the health you deserve or want.
So this
What is
person
it?
doesn't have breast cancer. Don't they say that people that take hormone replacement therapy have a higher risk of developing breast cancer? So that's what I think she was worried about. If
Well,
she
they-
takes hormone
yes.
replacement therapy, is the risk higher?
Oh, yes, it is. This is the Women's Health Initiative study, which came out about 15 years ago, which showed there was a dramatic increase in breast cancer, particularly with Provera, medroxyprogesterone. Okay, you need to know that. With natural progesterone, there didn't seem to be, but the combination medication, which is, I believe it's Provera, is medroxyprogesterone, and that was the form, the synthetic form that was associated with, I think, 2.5 times the risk of breast cancer in women who took hormone replacement therapy. But this Provera has been almost routine, thanks to the drug detail people pushing this, this drug, this brand name costs a lot of money. So they've gotten most of the female population on medroxyprogesterone rather than natural progesterone. So certainly I'd make sure that wasn't the case. But if you look up the Women's Health Initiative, it changed the world. Like a third of women who are on hormone replacement therapy quit that day because of this finding. You also have an increased risk of uterine cancer, which is benefited by taking progesterones. Again, don't take medroxyprogesterone. You take natural progesterone. So let me add one more thing. There is actually a little bit of research, not much, which shows that progesterone, natural progesterone, not medroxyprogesterone, natural progesterone actually benefits breast cancer. I have one study where they did biopsies of a woman's breast, serial biopsies, and they looked and they found inflammation, hyperplasia of the milk ducts when they were on estrogen. And they added progesterone, natural progesterone, to reverse this hyperplasia. It's one study. But, with the Women's Health Initiative, it should tell you to stay away from Provera. And I think I have that right. Look up Provera and see if it's
Well, I have to give you this other one first. The
hyperthermic.
HIPEC is hyperthermic
Oh,
intraperitoneal
oh,
chemoperfusion.
oh, I like that one.
It's one of the most innovative treatments available today.
They've only been using it for 50 years. Okay.
Combines surgery with chemotherapy
And
for the treatment of cancers such as peritoneal mesothelioma, hyperthermic oh man.
all right, this has been going on for at least 50 years. The idea of, at times they'll actually heat the blood. They'll put people in hot baths. They'll put them in some kind of machinery that causes the body temperature to rise. The theory being that if you raise the body temperature, or the theory being when you get sick, you raise the body temperature. And you do a lot of other things which they forget about.
Because you get a fever.
Yeah, you get a fever, all your immune system is set up. Fever is just one part of the immune response. And the only thing this hyperthermic offers you is the fever. It doesn't offer you all the antibody productions, all the changes that take place to heal the body. And that's why this particular approach has been fraught with failure. Look it up. You know, actually, one of my good friends, Agatha Thrash from Uchee Pines, Georgia. You can look her up. Agatha Thrash, as part of her routine, in addition to prescribing, very similar to the McDougall diet, she was an Adventist. She used to use hyperthermic treatments to treat inflammatory arthritis. And she complained to get really good results with rheumatoid arthritis, etc. But remember, the thermia is just the fever. It's not the rest of the immune response that takes place. It's only a rise in body temperature. That's it. Don't expect a lot. Expect as much as you get from the chemotherapy and the surgery. That's what you should expect. And we'll go into that later. Not much. A lot of high-priced drugs. That's what you'll get. Treatments. You know, if you would just look at the science. You know, and I put together a series. I've got lots of lectures on YouTube, but I put a series of 5 lectures on diet therapy together for my colleagues. Unfortunately, very few of them have been interested in it. They're not aren't interested in how I treat breast cancer, even though I fly right in their face with surgery, radiation, and chemotherapy recommendations. They don't stop me. You don't see anybody coming after me and saying, "Hey, you're keeping people from these wonderful treatments." No, they know what the truth is. All right, so if you watch the lecture on cancer, lecture on heart disease, you'll know that heart attacks occur from the rupture of a plaque, and that all heart surgery studies show no benefit in survival. You won't find anything otherwise. You'll also find, if you look at it, that our ancestors were starch eaters. Look it up. I'm not telling you anything you can't verify yourself. All right, anyways, hyperthermia, good luck. Let us know if it works.
Thank you. Okay, next question. Oh gosh, there's so many coming in. I'm sorry, I won't be able to get to them all. This
Well, you
is
know,
from,
it's just a good
yeah,
It's just a good thing we have so much interest, that people would ask enough questions, and hopefully that day will continue. It will continue forever. And we're counting on you folks to help us build the audience. You need to get your friends and relatives and the people you love to hear this message. Remember, all I want you to do is give us a chance. You know, give us a week, 12 days, a month. Certainly, you can afford 4 months. Give us a chance to see if we can solve your problems without all the expensive treatments out there that do little or no good, because they address not the problem. The problem's the food. You can't give pills to fix the food. Just doesn't work. You don't have enough pills. You got to fix constipation. You have to fix cholesterol. You have to fix blood pressure. You got to fix arthritis. You got to fix diarrhea. You got to. Good grief! I don't think there are that many pills. Well, I know there are not that many effective pills. Anyway, I don't know, how do we get on that?
I don't know. I'm just going through all the questions and it's just so hard to sort through them all. But here's an interesting one that we haven't gone over. What causes ankylosing spondylitis?
That is an inflammatory arthritis. Okay, it involves the spine and the sacroiliac joints and some of the other large joints in the body. It's a dietary disease. If you look up the article I did on YouTube on arthritis, you'll find the reference that shows you ankylosing spondylitis is only a disease of Western civilization. Okay? In rural Africa, it didn't exist. The references are there in that lecture. You can find it. So it's a dietary disease. It's like, this is why I don't call things by their common names. I don't call this rheumatoid and this lupus and this ankylosing spondylitis and this psoriatic arthritis, because they're all basically the same thing. They're the same natural history, same non-prescription drugs, non-steroidal anti-inflammatory drugs, same prescription drugs, methotrexate, you know, all the new stuff you're watching on TV, steroids, same thing. I don't care what you call it. They don't know what causes it. I do. They've got the same symptoms and signs, use the same drugs. You're amazed by that, aren't you? then
Really?
Mary goes, oh, they're using Quippy? What's it called?
No, a Rinvolt.
Rimbo. Well, today it's being used for ulcerative colitis. Oh, tomorrow it's psoriatic arthritis. Yeah. Look, I call these diseases because they're all basically the same. Treatment cause, not knowing what causes it, failure, etc. Nobody's cured these inflammatory arthritis. I call them inflammatory arthritis as opposed to osteoarthritis or wear and tear arthritis. That's the right name, inflammatory arthritis. And then you can put everything under the same category and say, well, this particular person, they got, a butterfly rash and they got kidney trouble. Okay, we'll call that lupus. They got positive ANA. We'll call that lupus. Okay, this patient got multiple joint pains and they got a positive rheumatoid factor. Okay, we'll call that rheumatoid arthritis. You see, they put them in these categories. And I think that it happens for a couple of reasons. One is the patient goes in and says, oh, I hope he can find out what I have. If he could only give it a name. If he could only give it a name, I'm sure you'd have this wonderful treatment. And the doctor thinks he or she's done her job by giving it a name. And that's all you've done. You just put it in little boxes. You've taken the big box of inflammatory arthritis and you put it in a little box called lupus, a little box called rheumatoid arthritis, a little box called ankylosing spondylitis. You're not helping the patient. There's no, except that you get a false sense of accomplishment, both by the doctor and the patients. We finally found out what you have. Excuse me, I knew what you had just by a couple of sentences you told me. I don't have to. Anyway. That's
Thank
where
you.
history comes
Yeah.
in. If a doctor, and I teach my students this, if you haven't figured out what's wrong with the patient by the time you're done talking to them, you're not going to figure it out. You've got to figure it out with the history. The physical exam, the lab tests rarely add to your diagnosis. Rarely. You get surprised. Talk to your patients. They'll tell you.
Ready?
Okay. Whatever.
Josh wants to know if the McDougall diet can help with hepatitis C.
Not any more than a general help. Hepatitis C is an infection. And, we have hepatitis A, B, and C. And, fortunately,
What's the difference?
well, I don't know this is really any clinical difference. It's just a difference in the virus.
Okay.
So they discovered hepatitis A first. Well, hepatitis A is more foodborne. You get it from water and food. Hepatitis B is more from sharing fluids, intercourse,
Okay.
blood transfusions. And hepatitis C, I believe, is the same thing. It's spread by that kind of intimate contact, getting a tattoo or, sharing needles on the street, that kind of stuff. But there's there are some treatments out there for hepatitis A and B, and you should look into them and see if they're for you, because there's a lot of new stuff, But I just want you to know that our family's been fully immunized, at least for A and B. I can't remember whether we
No,
did C or not,
C.
but
A
at least
and B.
A and B we have. They're very effective immunizations, and these are real problems. People get all three of these viruses, like on in your community on a daily basis. This is not unusual.
Thank you.
But
What about,
there's no one. I was going to say, the person, you need to look it up, because I just haven't kept pace with the drugs that they now have that say effectively treat the various viruses. So again, you caught me a little short of knowledge here, but it's easy to find, isn't it?
the internet's amazing. What about Streptococcus A?
Streptococcus is a bacteria. Streptococci is communicated airborne, and I believe it's another foodborne disease. But Streptococci infects the skin, gives you impetigo. Yeah, it's a pretty common bacteria. So
eat clean food,
look it up.
wash your hands.
Yeah, don't eat animal foods, first of all. First of all, you need to understand that it's the animal foods that develop these pathogens that affect us. they're called zoonosis, Z-O-I, never mind. Anyway, that starts with a zoonosis. They're infections that, like we started talking about tonight. So I talked about bird flu infects cow because we're both animals, all right? I mean, birds and cows are both animals, right? And people, guess what? We are too. Okay, you got it. We're animals too. So you can spread these diseases among animals. It's called the animal kingdom. And then you have a drastically different kingdom known as the plant kingdom. You can't share diseases between the two. You don't have friends with Dutch elm disease or tobacco mosaic virus. None of your friends got aphids this year, okay? And none of your plants got streptococci. Where does it say it come from?
It says it's
Nasal.
as the bacteria spread by direct contact with nose and
Doesn't say
throat
anything about food.
discharges. No,
Okay, maybe not. I wasn't quite sure.
nothing food.
But anyway, streptococcus, it just says it causes hepatitis. I got that one right. Skin infections, I remember that.
Yeah,
Anyway, it's treated effectively with penicillin.
yeah, antibiotics.
It's just one of the easiest infections to treat. A little penicillin, or you can even treat it locally if it's a skin infection like scabies, or not scabies, impetigo. If it's impetigo, you can treat it locally. But pills work really good. I remember that I just give a little bit of penicillin and everybody will be fine. Kills the bacteria quickly.
Thank you.
And penicillin, by the way, is a great drug. It's not out of date. You know, we've developed a lot of drugs because of the resistance to penicillin, but it's still one of the best drugs that doctors should be prescribing. Plain old penicillin.
Is ampicillin the same as penicillin?
Well, that's a derivative to help with some of the resistance that the bacteria developed. So it's another derivative, but plain old PenVK is an amazing drug. No.
Babs is writing in and she's wondering how she can gain weight with type 2 diabetes.
Well, she doesn't have type 2 diabetes. She's too thin. That's the first thought. She has type 1.5 diabetes. The lecture on YouTube on diabetes will educate you on the spectrum of diabetes. Type 1, you don't make any insulin. The pancreas is damaged. Boom. You got to take shots. Type 2 is due to you being too fat. If you lose weight, it always goes away. In between, there's something I call type 1.5 or partial pancreatic insufficiency. And that's where you make enough insulin. Pancreas is damaged, but not terribly damaged. Enough insulin to stay out of the hospital, to keep out of ketoacidosis. But you don't have enough insulin to push fat into fat cells. That's what insulin does. It allows fat to go into fat cells. And it also stops weight loss and excessive urination. The insulin does. And so what you do is you give a little extra insulin to somebody who's having trouble with weight and solves it just like that. All of a sudden they're gaining weight. And the sugar they find in their urine is gone. Their excessive thirst is gone. Their frequent urination is gone. And their numbers look better, but they feel the same. That's the problem. You feel the same. You don't feel, unless you give too much insulin. I give Lantus, by the way, which is a long-acting insulin. And I give one shot in the evening with somebody with type 1.5 diabetes. So they take 5, 10 units. That's about all in the evening. Takes care of it. Ain't no big deal. But your pancreas is not going to come back. However, you can get rid of some insulin resistance, which is part of this partial insufficiency. You have some insulin resistance. So if you can still lose some weight, you said you couldn't. You can still eat healthier. I didn't ask you whether you could or couldn't. Now, if you're thin and still eat a bunch of oil and fat, it's going to paralyze your insulin. So there may be some improvement you can make even on the diet you claim yourself makes you too thin. There are a lot of thin people eating garbage. Not a lot, but some. Maybe 9% of the population.
Thank you. I'm glad you brought that up. I figured it was type 1.5, not type 2. I've been listening to you for too many years.
but it confuses the patient terribly. They're told they have type 2 diabetes and they act just like they have type 2 diabetes. And nothing seems to work out well. They have high blood sugars still, they're frequent urination, excessive weight loss. Nothing just seems to be right because they don't have type 2 diabetes. They have type 1.5. They need a little extra help. And then things go well. And you only have to take 1 or 2 shots a day. And you have to eat a good diet.
Thank you. Next question. Elizabeth is writing in and she's wondering if it's best to keep protein as low as absolutely possible if you have autoimmune disease. And if yes, what's the reason?
If you have autoimmune disease, I don't think it matters what amount of protein you eat. It's the kind of protein you eat. So autoimmune diseases are caused by foreign proteins getting into your body and your body thinking this foreign protein is a virus or bacteria. So when we eat animal foods, they go in the gut, through the gut wall. They're not supposed to. The proteins aren't supposed to go through intact, but they do. And then they float around the bloodstream intact cow, fish, pork, etc. protein. And the body makes antibodies against these foreign proteins that come from cows and pigs, etc. But the structure of the protein of the human body is similar to the proteins in these other animals. Why? Because we're animals. So if you eat plants, no matter how much, even if the plants somehow get into your bloodstream, your body's not going to confuse them. They're not going to look at the plant and say, oh, all of a sudden I become a plant. No, you're still an animal. And the plant proteins aren't going to bother you. So the amount of protein doesn't matter. It's the kind of protein you're consuming. But in general, you want to have a sensible protein diet. You can't make a too low protein diet. Not any natural diet. It's impossible to make a diet too low in protein on natural foods, any natural diet. Okay, but you can easily make it too much protein, which causes osteoporosis, kidney stones, liver damage, kidney damage. A lot of people with autoimmune diseases, I just want to generalize here. If you got an autoimmune disease, you got it all over your whole body. It's not just in your kidneys or your joints. The whole body's being affected by this disease. So, you may have an autoimmune disease. Well, how are your kidneys? Oh, maybe you lost half your kidney function from your autoimmune disease. Well, now protein's really important because to preserve that kidney function, you need a low protein diet, including low in vegetable proteins. So you're dealing with a lot of things here. And anyway, you should be able to sort them out. And based on what I told you, it's the animal protein quality, not quantity, to get you in trouble. But there's a lecture on YouTube on autoimmune diseases.
Oh, I'll put that in the chat.
Pretty much everything I know, I've either written down or put it on YouTube for you, or the new stuff, the confirm me stuff we'll do here on Sunday nights, 5 o'clock Pacific time. Tell your friends and relatives. Mary and John and Heather will be here with you and for you. But,
you could spend days on our YouTube channel watching all your videos. I think there's over 700 videos on there. So you could literally spend.
Well, that's what happens when you've been done doing. And I've been on this particular course for 47 years. Prior to that, I was a training doctor. I was a resident, a medical student, and et cetera. But it's been 47 years I've been practicing this way. So I've run across a lot of stuff. I had a lot to say. Fortunately, it's not outdated. It was, you look around you, you see all these healthy people. Finally got rid of that stupid McDougall advice. Now we got it all figured out. Look at all the healthy people around you. 91% of people are too fat for their health. Can I say that again? 91%? Too fat for their health. So you tell me where the well people are. There are a few of us. That's it. Maybe 1%, 2%, 3% of the population has figured this out. The rest of the people are either genetically privileged or they don't eat very much, or they're sick all the time with hepatitis and they don't eat. There are a lot of reasons people are too thin. It doesn't necessarily mean you're healthy just because you're thin.
Here's a good question. This is from Peter. He's wondering if it's possible or likely to overdose on plant nutrients by concentrating the nutrients in juicing.
Well, I don't think so. I don't know. Okay. There are things like Juice Plus, and there are other kinds of pills that they sell on TV now, supplement pills. I can't remember the names of them. But what they do is they compress fruits and vegetables into and take the water out. They compress them into tablets. And I've never taken the trouble to research it. I will, on whether or not this concentration, which is in a proper balance, by the way, because all they do is take the water out. Okay, so I mean, when you eat these pills, you drink water with it. So does it reconstitute it and make it as good as fruits and vegetables? I don't know.
What about
I do
regular
know-
juicing, though? Not the juice pills,
Well,
just,
yeah.
yeah, sorry.
Yeah, regular juicing wouldn't be a problem. But I do know that vitamin pills are dangerous. The research clearly shows that you increase your risk of dying, heart disease, and cancer by taking isolated concentrated nutrients in the form of vitamin pills. Don't do it. The question was about juicing. I just want to tell you what you don't do and what I don't know. What I do know is a guy named Heaton in the Lancet back in the late 70s. You can look it up. Did an experiment where he took an apple and he fed it to people and he connected their vein so he could take frequent blood out and do testing so that he could test for glucose and insulin. And what he did is he fed the apple to his subjects and he looked at the rise in blood sugar. It just went up a little bit and then went down a tiny bit below what it was before. And then he ground up the apple and made applesauce. The stems, the peels, the seeds, everything, applesauce. And he gave it to the subjects and their blood sugar went up, maybe a touch higher, not much, but it went much lower. And then he took the pulp out of the applesauce and fed them juice. And the exaggeration was much greater. Rise in blood sugar, profound drop in blood sugar after eating. Why? Because insulin levels were increased dramatically when you refine the food. You disrupt the structure of the food when you hit it 1,000 times with a steel blade. Is this important? Not for most of you. You know, most of you want to include juices because they're enjoyable. After all, juice tastes sweeter, doesn't it? Because they've broken up all the cells and let the glucose out. That's why you eat carrot juice. That's why it's so sweet. Anyway, if you want to eat juices because you think they're healthy, you don't have to lose weight, and you don't have to lower your triglycerides, and you're not on any other margin of health, then big deal. I mean, good grief, the body can tolerate a little juice. And we use one juice at the program, and that's prune juice. And the reason we recommend prune juice is because people come all plugged up and we need to clean them out. And so we encourage a couple of glasses of prune juice the first few days. And boy, oh boy, is there a change in the bathroom. Big deal. Anyway, that's the only juice we use. But again, don't consider the abuse that you put yourself through. I mean, myself, I'm not going to go through all the horrible things I've done to myself. But I do know, and I'm sure of this, Mary, if I'd have known I'd lived so long, I'd have taken better care of myself. That's a
You hear that all the time.
I'm sick. I'm done hearing that. I didn't take good care of myself, or not as good as I could until I discovered this.
How many times have we heard that from other people too?
You know, I was on a self-destruct John McDougall before I was 25 years old,
Yeah.
maybe 27. I did everything I could to kill myself. Smoked, drank,
Well,
ate
you
ham.
didn't know that you thought it was okay.
Thank goodness I wouldn't be here today. That was 1977, folks, a long time ago. Thank goodness I'm still here. I'm alive, but I could have been better. Those first 27 years set me back. Had a stroke, weighed 90 pounds more than I do now. Had major abdominal surgery, was constipated, stomach. My first 27 years would be, it'd be a horror show if I had to tell you about it.
But
Not
you
gonna
had to
tell you
go
about it.
through all that, Dad, to become the doctor that you are today. So
I know that, Heather. I really do. Because, you know, somebody can say to me, well, you don't understand. No, I do understand. I used to be a really sick guy. And, you know, so I can sympathize and empathize with you.
thank you. We appreciate you both. Time's up. That was an hour. It went by fast.
Oh, Heather, it gets me, it's so much fun. I really look forward to this time.
Me
But
too.
when's our next program, in case people are interested?
July 19th, and it's already filling up. So if you're thinking about signing up, do it now rather than later.
I think if all goes well and people are finally listening to us, it's not that we haven't given you a positive, important message. It's just that nobody's listening. And, if people start listening, Heather, you're gonna have to be prepared to add another program, et cetera. But yeah, we have a program coming up in July. But the nice thing is that, I guess now Dr. Lim's free. He can start seeing you as of today or tomorrow and start resolving your problems. And then at least better prepared for the program is in July. Anyway, real fun to spend time with you. We'll be back here next Sunday night, 5 o'clock Pacific time on the McDougall YouTube channel.
We look forward to it. Thank you all for tuning in. Thanks, Mom and Dad, Dr. McDougall and Mary. Have a great weekend.